Bienvenidos a Sinapsis, el podcast de los especialistas de Sonepsyn, la Sociedad de Neurología, Psiquiatría y Neurocirugía de Chile.
Hola, buenas. Yo soy el doctor Felipe Crocco Carrera, soy médico residente de Psiquiatría de Adultos y miembro del GDT de Psicopatología, Filosofía y Humanidades. Hoy día estamos con la profesora Julie Nordgaard de la Universidad de Copenhague, doctora en Filosofía y en Ciencias Médicas y parte del equipo de prevención temprana en psicosis de Psiquiatría en Dinamarca. Con Julie hoy día vamos a conversar respecto a los trastornos del self y sobre la psicopatología como una rama importante a considerar en la psiquiatría clínica. Así que vamos a llevar la entrevista en inglés y ahora vamos a empezar. Hello, Julie. Thank you for joining us today. Welcome.
Thank you.
I wanted to start this interview by asking you if you could tell us a little about your career and maybe your research choices.
Yes, well, thank you for inviting me here. I've been working in psychiatry for almost 25 years, and I have, all through my career, worked both clinically and have done some research as well. So the later year, I have had more time for research and less time for clinical work. And as a clinician, I've been working in hospitals and outpatient clinics, mostly with severe mental illness, and a lot with schizophrenia spectrum disorders. I've been working with homeless patients as a street psychiatrist for a certain amount of time. And I've also worked with early detection of psychosis and first episode psychosis.
Nice.
And for my research, I have always been really interested in psychopathology and how to diagnose and how to assess psychopathology to make the best possible diagnosis. And that have been sort of the key point of everything I've done in research. The focus has mostly been on schizophrenia spectrum disorders, but I am generally interested in general psychopathology.
All right.
Yeah.
All right. And I believe you have done extensive research on self-disorders.
Yes.
And could you please tell us more about that? What are self-disorders and what do you think the importance is of studying self-disorders?
Yes, I would love to. Self-disorders are perhaps sort of more subtle psychopathology, that it is a phenomenon that is an expression of a fundamentally disturbance of the basic self. And these disturbances are trait phenomena, and they are non-psychotic, and patients they are seen in schizophrenia spectrum disorders, and with schizophrenia spectrum disorders, I'm talking about schizophrenia and schizotypal disorder.
I understand.
And they are a trait phenomena, so they are present before frank psychosis and also after frank psychosis. Yeah. It is not a new phenomenon. It was actually described under various names such as Ich-Störung or ego disorders by in the classical psychopathology in France and Germany.
Yes, a Spaltung too, right?
Yeah,
by
definitely. Yeah, definitely.
So I do believe that there is a difference, a conceptual difference between a narrative self and a basic self, right?
Yes.
Could you speak a little bit more about that so we can understand that?
Yes, definitely. You're completely right, because the term self is polysematic. It has a lot of different meanings. For this purpose, psychiatric purposes, it might be most important to distinguish between sort of the narrative self, which is a rather complex structure. This is who am I as a person, and this gives the answer to this, who am I? So it's about characterological features, temperamental features, and it is at least partly called the narrative self because this is the This is created by, or is the story I tell and others tells about me and who I am. It will also be what are my preferences and what do I think about this or that. And so this narrative self should be distinguished from the basic self. And the basic self is actually a very thin concept. The basic self only designates that my experiences are given for me in my first-person perspective, meaning that I, without needing to think so pre-reflectively, know that it is me who is thinking, it is me who is talking now, it is me who is seeing and thinking. Yeah, and I don't need to reflect about this. So I do not sort of get the experience, oh, some thinking is going on, I wonder, oh, it's me who's thinking.
Yes.
I know it immediately and I don't need to reflect upon it.
So I understand also that this concept of basic self is not new, right?
No.
As you just said.
No.
But something happened in the 90s in Denmark with Professor Parnas, who was studying this. Could you tell us a little bit more about how this concept came again with you?
Yeah. That's completely right. Correct. Professor Parnas and colleagues, they were doing some very thorough interviews with patients with first who were admitted and was with the first episode psychosis or maybe suspected of schizotypal disorders. And they did these really comprehensive interviews with them, focusing on their subjective experiences. And what they learned was that the patients were telling about the same subjective experiences. It was there were some themes, and it was some of the same problems that they were talking about. And then they went back in the classical literature, psychopathological literature, and found that there were descriptions of this already, and that was sort of what started it. And what was really interesting, I think the first paper on this was published in 1998, and very shortly after, a paper came out from Norway, from a group who has sort of rediscovered precisely the same. And the two groups, they did not know of each other. Of course, they instantly got in touch with each other when this was clear that they had been simultaneously working on the same issue and sort of rediscovering the same issues. So this was the beginning of reintroducing this concept in psychiatry again.
Yeah, I understand. And when did you came about joining Professor Parnas in all this?
I joined Professor Parnas' group around 2001. So it was just a new concept at this time. So what I have been doing, being a psychiatrist, I have done a lot of empirical studies on this, trying to sort of prove or show that this really is relevant. So I have interviewed a lot of patients in research projects, of course, using the E-scale, because the self-disorders, then the concept of the rediscovering of self-disorders led to a creation of a semi-structured interview that could be used for assessing self-disorders, and that is called the E's, or that is an abbreviation of examination of anomalous self-experiences. So with this scale coming out, I have been one of the person who has really examined the usefulness, both for clinical purposes, but also for research purposes.
Yes. So you have also been conducting courses on the ACE interview, right? And recently you conducted a course here in Chile. I think it's the first time you do it in Latin America.
Yes.
Right? So in which other places have you conducted this course, and how many times have you done this?
We have actually conducted EASE courses. We have several levels. We have the introductory EASE courses and we have the advanced EASE courses. And it was an advanced EASE course that we just did in Santiago.
Yes.
And, actually the E's have been translated into, I think it's 14 languages today, and new translations are coming on the way. So there's been worldwide interest in the phenomenon of self-disorders, and there have been done research worldwide.
Yes.
So, so there has been a lot of interest, and we always, we sort of continuously do international courses in Copenhagen, both for the introductory course and the advanced courses. But we have been invited to do courses many places. We have actually done an introductory course in Brazil.
Okay.
So the introductory course has been done in South America before, but not the advanced.
All right.
We have done it in the US, at Harvard, at McGill in Canada, in many places in Europe, many different countries.
Nice.
Yeah.
So, thanks to this, there are many new researchers on this topic, right?
Yeah.
Could you tell us a little about the results you've been having in this more than 20 years, right? Applying the interview?
Yeah, sure. Well, I think it's really a pleasure to see how the interest of self-disorders is growing. And I think it's also so important that other groups than just ours are using the ease, of course, for clinical purposes, but also for research purposes, and are finding, it is pretty consistent, the findings of these studies all over the world. And we recently did a systematic review on the empirical findings using the E-scale and on self-disorders. And what has been shown is that there is no doubt, I think we included, there is around, 60 studies on self-disorders now. And around 30 studies have looked at the specificity of self-disorders for certain diagnostic categories. And they all show that self-disorders hyperaggregate in schizophrenia spectrum disorders, but not in other disorders, neither psychotic disorders nor non-psychotic disorders.
Exactly.
Yeah.
Exactly. So I saw that, for example, this could be useful for differential diagnosis, right?
It seems so. Of course, we need to keep in mind that they are not self-disorders are not diagnostic in the understanding of they're not including in the diagnostic criteria,
Exactly.
not in ICD-10, not in ICD-11, and not in DSM-5. So we need to keep that in mind. Of course, we need to diagnose in according to those. But I think the self-disorders are very helpful when you are not, when it is a bit difficult to see to categorize what is the problem here, then it's often very useful to examine for self-disorders, and that will often lead for the patients to be able to articulate their experiences more.
Yes.
And I also think that is not the idea, because it's purely descriptive psychopathology. That is the point with self-disorders. But what we have discovered is that many patients find this almost therapeutic to talk about the self-disorders, because they have had these experiences often for many years, and they have thought that they were the only one in the world having these experiences. Yes. So it gives them kind of a relief, many of them say, to talk with a psychiatrist who actually knows about these kind of experiences.
Yeah. That actually was my experience while conducting the interview. When we closed up the interview, the patient also told me that.
Oh, that's nice.
Which he felt he was more comfortable talking about these strange things that he had never talked about before. So
precisely, but that's really nice. Really nice to hear that it also resonates so well here, because Latin American is obviously another culture than Northern Europe, right?
Yes. So did you expect it to be to find any difference between what we showed you here in our interviews and what you found in Denmark or in Europe?
No, actually I wasn't. But of course we should always keep the cultural aspect in mind. So it is really important to have people who knows the culture when we examine this. But all of you who participated in it are all Chileans, right? So you could sort of translate, but I don't think that there were any differences.
Yes,
no,
exactly.
That was
we actually found many similarities, right?
Exactly.
Yeah, so that's interesting.
Yeah.
And I think this takes us to another topic, which is the topic of general psychopathology and the development of psychopathology in the world, in the aims of getting to some consensus, right, about the nosology and how we classify how do you say it, mental disorders, and also the theoretical basis to help us understand, to have a way of thinking about and talking about what these people are experiencing. And in this sense, it is known that not all clinicians are agree on what schizophrenia is or what bipolar disease is. So, given the fact you've studied psychotic disorders in a very specific way, I would like to ask you, what do you think are the main challenges of psychopathology today regarding inter-clinician reliability and the need for consensus in schizophrenia in particular?
Well, the inter-rater reliability is sort of a haunting in psychiatry.
Yes.
And it was very much a knowledge in the beginning of the 1970s, which led to the operational criteria, which with DSM-3 and ICD-10 as the first one of those kinds. And those were meant to solve the problem. Unfortunately, I don't think they solved the problem. There's no evidence of them solving the problem, but unfortunately, they might have caused some other problems, because I think today there has been a severe decline in the knowledge of psychopathology.
Yes.
So the kind of psychopathology many people or many psychiatrists know are the criteria in the ICD or the DSM. So, and especially in schizophrenia, of course, this psychopathology for schizophrenia that is listed in the DSM or the ICD is important. But there is much more. And the idea with the diagnostic criteria was never to be sort of a full description of the disorder. It was only to eliminate the disorders. But I think that knowledge went into oblivion. So at least in Europe, we see that many textbooks on psychiatry, they only describe the criteria. So a lot of all the other kind of psychopathology that we see, for instance, in schizophrenia, the knowledge about that is almost gone. And another thing is that research into psychopathology has almost disappeared as well. We are not many groups in the world who do research in psychopathology. And I think it is really important that we sort of have really good concepts, both on each of the psychopathological phenomena, but also on the disorders, on the categories that we are talking about. And I think we need to keep aiming at getting it better and higher inter-rater reliability.
Yes.
Because it is important that when we talk about, for instance, schizophrenia, that it is at least a sort of the same concept that we are talking about.
Exactly.
And I think that is a big problem still, unfortunately.
Yes. So how do you think we can advance on this, move forward somehow? I've been thinking about this question myself, and about the importance of maybe having a solid philosophical background to support the psychopathological investigations. So what do you think we should do to move forward in this?
Yeah, well, it is $1 million question, right? So I don't think I have a good answer to it. But I completely agree. I think we need to be assisted by philosophy, because we do have a problem with our concepts. Our concepts are not very clear, and many of our concepts sort of we have not been able to give really good definitions so far, and I don't think the philosophers will be able to do that as well. But we need to describe them as good as we can. We can describe it much better than we are doing today. And I think that is sort of the first step, that there is sort of an agreement on what does this and that concept mean. So I think that would be a good place to start. Yes. Then I think it is really important that we read the classical psychopathology, because there are actually excellent description, even though much of it is almost 100 years ago since it was written. But in continental European countries, especially German and France, there were some incredible psychopathologists who have written excellent books. And I think we need to sort of maybe return a bit to that and see what can we actually use what they did.
Yes.
And I think that is always a good way, sort of when you get lost in the forest, you return to the last place you knew,
Yeah, exactly,
right?
exactly.
So I think perhaps that is a bit of what we have to do, but of course in a more modern way.
Yes.
Yeah.
I totally agree. I do believe that it's very important that we go back to the previous authors who have wrote about this and see also what are their inspirations, right? As when one reads Minkowski, you can find that he takes his inspiration in Bergson, who has a very specific kind of philosophy,
Yeah.
or
Exactly.
Jaspers with Heidegger, and Husserl, right? So I do believe it's very important to know which are the roots of this kind of thought, of this kind of looking at the human being, right? Of understanding consciousness as a totality. And another question I wanted to ask you is about the impact of studying psychopathology in how do we treat our patients, and not meaning on treatment, but on the encounter, the human encounter.
Yeah.
I've thought about this, and I do believe that when you study psychopathology and get familiarized with this immense spectrum of human experiences, you can have a better insight on what the other person is experiencing, and maybe that helps to find a better kind of bond. But also I believe that when you start to focus so much on finding the symptom, you can have the risk of just looking at the other person as an accumulation of symptoms, and that maybe obstructs the connection with the other person. I'm not sure if I'm explaining myself well, but I would really like your comment on that issue.
Yeah, but I completely agree with you, because what we are examining, or sort of the subject in psychiatry, that is not singular or itemized symptoms. It is another person, sort of another consciousness who is embodied and placed in a certain context. So we need to look at the whole person, and there is definitely a danger when we start just looking for criteria.
Exactly.
That it is can almost be a bit dehumanizing. It might be a bit of a strong word, but we lose this focus of that all of these things are happening within a person.
Exactly.
Yeah. So and I think that's really important. But I also think it is more difficult. So it takes a lot of training to be able to do this, to sort of see the connections, because the symptoms and signs, they are not sort of isolated aspects or phenomena independent of each other. It all goes together, and with the person and with the experience of the person and the context the person is in.
Yes.
And we can't really evaluate it in a proper way as seeing, well, is this pathological or not, without seeing it in the full context and in the context of the specific person.
Yes.
Yeah.
Yes, I understand.
Yeah.
And there's a concept in the studies of psychosis which is called intersubjectivity, right? So one of the things that we talk about while studying psychopathology is this moment of encounter when you're interviewing a patient and you are trying to see if you can find this connection with the other person, or if maybe it feels kind of off, right? That you feel that you cannot get to the other person. And some clinicians think that a person experiencing psychosis is mostly somehow blocked to this intersubjective experience. So sometimes it can feel strange, but this arises the question of, can there be another way of making a connection in the interview, a human connection, whilst experiencing this kind of discrepancy of an intersubjective encounter?
Yeah, that's an interesting question. Well, yes, of course, and I guess maybe what you are maybe referring to could be sort of the concept of schizophrenic autism, that some patients, because autism is a part of schizophrenia, and sometimes when you get that feeling a lot, it can be difficult to sort of interact with the patient. But of course, it can also be due to severe psychotic experiences during the interview, or maybe paranoia in the patient. As we are talking, they might be a bit afraid what is going on actually. So there can be many reasons for this. Yes. And of course, the way to try and connect anyways depends on what is behind it. So, and sometimes it is not really possible, I think. But I think in most cases it is. And what I usually do is that I try to step a bit away from the psychopathology and from the whole clinical aspect, and try to connect on just sort of a more sort of general human level. So try to figure out, is there anything this person that I'm sitting next to, is what are their interests in, what do they like in life, or what is important to them? And sometimes, and quite often, I think this is a way to sort of connect and then make it possible to return to the concept of psychopathology.
Yes.
Yeah.
That's a very nice way of looking at it. I tend to believe that there's always a healthy part of the individual. There's not all pathological phenomena, and I believe that it's very important to learn to see it and learn to look for it also. Actively look for what is the healthy part, and in which way you can make the connection, although the person might be psychotic and although it might be sounding very strange and illogical. And I do believe this is important to keep the therapeutical link between the patient and clinician,
exactly.
right?
Exactly. And I still haven't met a patient who did not have anything interesting to contribute to the conversation.
Yes.
Of course they have. Everybody has that.
Yes. So this also, I think, touches with the concept of ethics, right? Ethics in psychopathology, and I do believe this is a very important issue that when we try to talk about a consensus, I think we should also put it on the table of how we're doing this and how we're conducting the interviews. Are we just trying to fish out these different elements and just try to point the score, the sheet, or are we trying to know the person better?
Yeah, exactly. I completely agree.
Yes. So we have just a tiny bit of time. So I would like to ask you if you have anything more to say or would like to share with our community. Maybe some final words, if you could.
Well, I think I always would like to stress, we have already touched upon it, but I would always like to stress the importance of reading the classical psychopathology. And you are so lucky here in Latin America, because most of the German and the French texts are translated into Spanish.
Yes.
And a lot of it is actually not even translated into English, but it is translated into Spanish. So read it, because you have the possibility. Yeah, and I think another thing is really important is to keep discussing psychopathology with your colleagues. We need to do that for the rest of our careers and see patients together, so we also calibrate and don't sort of drift into private ideas. So I think that's really important as well.
I totally agree with you. And I hope we can keep in touch and keep talking about psychopathology. So
I would like that.
Thank you very much for this, Julie.
Thank you.
Thanks.
Esto fue Sinapsis, el podcast de los especialistas de Sonepsyn. Encuentra más episodios y contenidos en nuestras redes sociales y en sonepsyn.cl.